Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Deena Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide a brief update, and then we will open the floor to questions. I'll now turn it over to Dr. Hinshaw.
Thank you, Tom, and good afternoon, everyone. Today, I would like to update you on the COVID-19 case numbers over the long weekend and announce a shift that we are making to help make testing safer and more efficient at assessment centres. There are currently 97 people in hospital in Alberta, including 13 in intensive care. We have seen an increase in acute care admissions in recent weeks, primarily linked to the outbreaks at the Foothills Medical Centre and Misericordia Hospital. 41% of our current COVID hospitalizations are due to acute care outbreaks. We are watching our province's health system carefully to ensure that hospitalizations and ICU admissions remain within our province's capacity. We identified on average 240 cases of COVID-19 a day over the long weekend. Breaking it down by day, on Friday, 236 new cases were identified, while our lab conducted more than 16,000 tests. On Saturday, we completed more than 13,800 tests. We also identified 259 new cases. On Sunday, we diagnosed 246 cases and almost 16,700 tests. And yesterday, the lab conducted more than 11,000 tests and identified 220 new cases. As I noted last week, due to the long incubation period of COVID-19, it will be at least a week or two before we start to see the impact of the voluntary measures announced last week for Edmonton zone. I continue to be concerned by the rise in cases. The Edmonton zone remains the hotspot in the province with 1,444 active cases right now. Sadly, I must report that there have been 4 deaths from COVID since my last update on Thursday. Any death at any time for any reason is devastating for those who are grieving the loss of a loved one. It can be especially difficult during a holiday like Thanksgiving. And it's made even harder by the pandemic, which makes gathering with friends and family more difficult at a time where you need their comfort most. My heart goes out to everyone suffering a loss at this time. Turning to schools, as of today, AHS has confirmed that 70 schools that previously had alerts have had no transmission, and students and staff are now back in class. There are active alerts or outbreaks in 209 schools. That is about 9% of all the schools in the province. Currently, these schools have 464 active cases in total. This number includes 88 schools that are on outbreaks, including 21 currently on the watch list. So far, in-school transmission has likely occurred in 53 schools. Of these, 33 have had only 1 new case occur as a result. While we have seen a rise in cases being identified within children between the ages of 5 and 19, this mirrors a similar rise that we are seeing in the community and comes as we have also seen significant increases in testing in this age group. Testing rates in this age group of 5 to 19 are more than double other age groups, and we continue to see a less than 1% positivity rate in school-age children. As I've said before, one of the best ways to limit cases in schools, hospitals, and continuing care is to limit transmission within the community. COVID-19 is a difficult virus to contain, and the more cases and spread we see in our communities, the more likely it becomes that we will see it in other places as well. That is why we all play a role in protecting each other, and why I encourage all Albertans, especially those in the Edmonton zone, to be extra diligent right now, staying home if sick, keeping distance from those outside your household or cohort, wearing masks when you can't, regularly washing or sanitizing your hands, and following the public health measures every day. It is also why we are making a strategic shift in our testing approach. Starting tomorrow, we will be shifting to an appointment-only approach to testing at AHS assessment centres. This means that Albertans will now be required to book an appointment to get tested at these assessment centres. For most people, this will have no impact on your testing experience. Drop-in testing is only a small part of the testing currently being done. In fact, about 93% of the tests are already being booked by appointment, online, or by calling HealthLink. By shifting to a province-wide by-appointment process, we will make on-site testing quicker and more efficient. We will also reduce crowding in lines and help ensure that everyone is tested as quickly and safely as possible. Anyone can book an appointment online. If you don't have access to a computer, you can also complete the assessment and booking process by calling HealthLink at 811 and speaking with a registered nurse. I also want to ask those who book appointments to be sure to keep them or cancel online if you are no longer able to attend. The assessment centres are seeing a high no-show rate lately, which causes further delays in making appointments available for those who need them. For example, Calgary saw a 14% no-show rate this weekend. It is easy and convenient to change or cancel your testing appointment online, freeing up your spot for someone else. Please help us make the system as effective and efficient as possible. We are committed to reducing the time it takes to get tested and receive your results. We are looking hard at ways to make this happen. Cold and flu season has begun, and as I've said before, we are seeing a rising number of people with COVID-like symptoms that increases our demand for testing. At the same time, we are conducting more tests than ever, averaging more than 16,000 per day. We are actively exploring ways to make our testing approach faster and more strategic, and I hope to have more updates to share in the coming weeks. There is another trend I want to talk about with respect to recent cases that is concerning. Contact tracers are reporting that an increasing number of people are reluctant to share information about where they may have been exposed to the virus, where they have been while infectious, and who they have been in contact with. It is understandable that people are tired of COVID and angry at the ways that their lives have been disrupted. Unfortunately, choosing not to work with contact tracers does not make that better. It makes it worse. If we are not able to trace contacts and prevent the virus from spreading, the impacts will continue to grow. If you are diagnosed with COVID, please don't turn any understandable anger against the contact tracers, who are doing their job as part of a collective effort to maintain manageable levels of transmission. It is critical that all of us show compassion and support for those who are cases or contacts to make it as easy as possible for those impacted to be able to work with public health and prevent onward spread. I know that for many people, it seems like COVID-19 has been around for years. It can be easy to feel like you don't have a voice or a say, but your thoughts and experiences matter. Last week, the Health Quality Council of Alberta released survey results that highlighted some of the many ways that COVID-19 has affected Albertans. This feedback emphasized the importance of the balanced approach we are seeking, preventing widespread COVID-19 transmission, while at the same time minimizing the impacts of public health restrictions as much as possible. It highlighted that in the spring, some people were choosing not to seek care for other health issues due to fears of COVID-19. Also, through documentation of the increase in anxiety that people were feeling, it emphasized the importance of the resources that have been made available to Albertans to support mental health. The Health Quality Council now has a survey asking for your perspectives on the pandemic and how the response has unfolded at this time. I want to encourage everyone to go to albertacovidsurvey.com and fill out the survey. As I've said before, there is no perfect path through this pandemic. Every choice comes with benefits and potential harms, and we must seek a balance between the harms of COVID and the harms of restrictions. This is best done by listening to diverse input, so I hope you have a moment to have your say. Thanksgiving is now over, and we know that winter is around the corner. The days are getting colder and the sky darker. I am asking all Albertans to embrace the challenge of the coming months. I know that many people missed out on family connections that we usually enjoy this past weekend. There have been many sacrifices we have had to make over the past 7 months, and while I wish it were possible to end these now, unfortunately we are not there yet. For us all, the only way to get through this is to continue working together and protecting each other. If we all keep doing the basics, hand washing, physical distancing, mask wearing when you can't stay 2 meters apart, staying home when sick, avoiding crowds, and staying safe, together we can lower our rate of transmission. It takes all of us, but together we can find the right balance to both minimize the risks of COVID and to minimize the risks of restrictions. Thank you, and I'm happy to take any questions.
All right, we'll go to the phone now. Operator, could you put through the first question, please?
Our first question comes from Julia Wong of Global News. Your line is open.
Hi, Dr. Hinshaw. A number of staff in the emergency department at the U of A hospital have tested positive for COVID-19. However, AHS, as the medical officer of health, has determined this does not fit the criteria of an outbreak. Yet, the province's website says acute care outbreaks are publicly reported when there are 2 or more cases, which this situation would seem to fit. So firstly, how many people have tested positive there? Secondly, can you clarify how come these cases were not publicly disclosed and how come this does not qualify for an outbreak classification? Even when cases at schools are identified and there's no link between them, they are reported publicly.
So the outbreak definition of 2 or more cases that are either present in a particular location while infectious or potentially acquired their infection from that location is the definition we use for schools. And of course, with acute care, if we do see 2 or more cases that are linked to a common exposure location, as you say, we do report those publicly. I don't have the details of the emergency department investigation because, of course, that is a local investigation and would be completed by the local medical officer of health. But my understanding from the information that I have received is that there are no connections that have been identified between the individuals who have tested positive, that their location of exposure was not identified as that particular emergency department. And of course, as we know, any individual who lives in a particular community can be exposed in many places, not just at work. And the details of those investigations, again, is exactly what local public health determines, so whether or not there is that common source. So again, the local medical officer of health would have more details, but my understanding is that there are no patients who've been exposed, there is no transmission that's been documented through this investigation, and that these seem to be unrelated cases, in which case it would not meet our definition of an outbreak.
Operator, could you put through the next caller, please?
Our next question comes from Carrie Tate of Globe and Mail. Your line is open.
Thanks. Dr. Hinshaw, earlier this year, Alberta Health had pledged to release timely information of fatalities related to overdoses. That was supposed to come before the second quarter report. I'm wondering, what's the delay? Where's the new tool?
The tool that was discussed is under development, and unfortunately the timeframes for developing that tool have taken longer than we anticipated. So I don't have a specific date on when that will be available, but certainly it is something that we are working on. And of course, given the toll that opioids have taken, not just this year, but of course in the past several years, it remains something that is critical to address, and the data accompanying that, again, is something that we are working to make available in a timely way, and more information on that will be coming when that tool is complete.
All right, Operator, could you put through the next caller, please?
Our next question comes from Francois Jolly of Radio Canada. Your line is open.
Hi, Dr. Hinshaw. Thank you for taking my question. I was wondering if you could clarify and maybe quantify what are the thresholds in terms of patient in the hospitals and ICU that would trigger a mandatory restriction. Last week you mentioned a criteria of 5% increase in hospitalization over 2 weeks. I was wondering what exactly that means. And also, I think the website may have an issue, so if you could just give us the total in terms of active cases. Oh, actually, I got it. So just my first two questions.
Okay, so with respect to the triggers, first of all, are looking at a cumulative 5% increase over the previous 2 weeks of 5% or greater. At the moment, we're sitting at 3.8% with respect to our Alberta numbers. And so, of course, that has been an increase. Again, we're watching it very closely. At this time, we haven't met that trigger. With respect to ICU capacity, what we're looking at there is 50% of the beds that are allocated to COVID-19 in ICU. And right now, again, we're sitting at less than 50% of those allocated beds. And again, watching those triggers very, very carefully, making sure that we are monitoring our ability of our acute care system to manage new cases. And of course, having put these voluntary measures in place in Edmonton zone, where we are seeing the majority of our new cases right now, as a measure to try to bend that curve down so that we don't end up hitting those triggers ideally.
Operator, could you put through the next caller, please?
The next question comes from Lauren Lynn of Global Calgary. Your line is open.
Hi, Dr. Hinshaw. Thanks for taking my question. Today it's about the Foothills outbreak. I'm wondering if you have any information on the investigation, including how the outbreak started, if it was initially brought into the cardiac unit by a visitor. If we don't have those details today, is there a timeline on when we'll find out more? And what is the threshold to consider these outbreaks contained?
I have not seen or heard any final conclusions from the investigation on the outbreak, so I'm not aware that there has been a conclusion about how the first cases were brought in. What I do know is that AHS has been working very, very hard to contain the spread, to make sure that onward transmission is stopped and that any risks to patients or staff or visitors are contained. When it comes to declaring an outbreak over, the criteria that we use is that we see no new cases within 2 incubation periods, an incubation period being 14 days or 2 weeks. So a particular unit that's on outbreak would have to have no new cases for a period of 4 weeks before an outbreak could be declared over.
Operator, could you put through the next caller, please?
Our next question comes from Dylan Short of the Edmonton Journal. Your line is open.
Hey, Dr. Hinshaw, hoping you could clarify on one of the previous questions that you asked. You said that we're still below the 50% in terms of ICU beds. I was wondering how many beds we have dedicated to COVID in the province and the number that we're at now. And then just with, we're seeing, different acute care facilities propping up some numbers in terms of outbreaks and cases. I was wondering if the province is looking at any further restrictions on visitors or who can enter these facilities at this time.
With respect to the ICU bed allocation, right now the ICU beds that are kind of in the system for COVID patients, the number is 70. We're sitting at 13 COVID patients in ICUs right now. And of course, we're working closely with Alberta Health Services to understand the implications of any increases within that span from our current state of 13 up to that currently allocated number of 70. And the question about visitors, there have been extra visitor restrictions that have been put in place in sites where an outbreak has happened. And we are looking very closely at the places where outbreaks have happened to try to understand where the importation of virus has come in and if a visitor policy might be part of that particular response. But we also know that visitors in acute care, visitors in continuing care can play a vital role in the care of those patients. So it is a delicate balance to make sure that we are restricting the risks of importing virus into those very high-risk facilities, while at the same time making sure that we are able to do what we can to support individuals who are at high risk for severe complications, but who are also at high risk of being isolated and potentially lacking access to supports for their recovery in acute care or for their overall health in continuing care.
Operator, could you put through the next question, please?
Our next question comes from Barb Glenn of the Western Producers. Your line is open.
Hi, Dr. Hinshaw. There's a rumor in the Lethbridge area that a large potato plant has had an outbreak of COVID. Can you shed any light on that?
So what I can say in terms of our publicly reported outbreaks that I know of in the Lethbridge area, we have publicly reported an outbreak at Cavendish Farms. I don't know whether or not that's related to potatoes or not, but that is the one outbreak that I'm aware of in a farming situation in that area. And ultimately, again, what I would say is that any location, any workplace where people are working closely together could be at risk of an outbreak. So any outbreak in any location is a reminder that all of us need to make sure we're taking regular measures every day, whether we're at work, whether we're with our family, kind of out in the community, whether we're again, in a recreational activity to prevent our activities from spreading COVID. And so, again, that's the one outbreak I'm aware of with 8 cases, but I'm not aware of any other farm-related outbreaks in the Lethbridge area.
All right, before we go to our next question, there is some technical difficulties with Alberta.ca. We are working to address them as soon as possible. Operator, could you put through the next caller, please?
Our next question comes from Sean Penner of Edmonton CP. Your line is open.
Yes, thank you, Dr. Hinshaw. I see that now with 41 active cases, the city of Grand Prairie is placed under a watch status. I'm just wondering if you've had any contact with local officials here about any other necessary measures for this area, and if you could, maybe what are some of the main reasons for the spread here in Grand Prairie?
I did have the chance to speak earlier today with officials from Grand Prairie and have a conversation about the fact that that area was going into a watch level today, as you say, with 41 active cases. The majority of those cases seem to be linked to a single large outbreak. It doesn't seem at this time like there's any really significant community risk that goes across the whole community. But as I said earlier, we do occasionally see these large workplace outbreaks that are a reminder that every workplace needs to be taking precautions to prevent spread within their employee group, as well as any kind of spread between employees and the public if they're a public serving business. And it's also a reminder that there's no part of the province that's spared from COVID-19, and rural areas that haven't previously seen many cases. Again, it can just take a few active cases showing up in a location where measures are not being put in place or universally followed to unfortunately go from 1 or 2 active cases to many. And it's just a reminder again that we all need to be following the measures that are in place across the province. At this time, there's no indication that there's any additional measures that are needed in Grand Prairie. But again, just a reminder that we do need to work collectively in all of the places that we spend our days. And as I said earlier in my speaking notes, that includes when people are diagnosed with COVID or identified as close contacts, working with public health, because that is one of our most effective tools at preventing widespread transmission is through our contact tracing and our case investigations.
All right, that's all the callers we have today. Thank you for joining us. Dr. Hinshaw will provide another update on Friday afternoon. Have a safe day, everyone.